Thank you. Good morning, and thank you to Terrence and Melissa. Listening, I almost feel like I should break out in song right now so that, but don't worry, I won't. It's when you reach that age where you have to take your glasses off so you can see, that lets you know how far you've come in life. I want to start this morning by saying how deeply I appreciate the work that CarePortal and everyone in this room today are doing to support and strengthen children and families. What you do is critically important to help bring hope to other people's children. CarePortal changes children's lives so that they can dream big dreams, knowing that there is a pathway for them to thrive, but also knowing that there's a pathway for them to live their full potential and a pathway for them to live out the dreams they envision for their lives. Those pathways and the work that you do exemplifies the power of hope in your work. It is the power that drives families out of a darkness. When I think about the light of hope, I think about hope being that thing that keeps you moving forward in a dark tunnel, when there's no light in that tunnel with you. But you believe deeply that if you just keep moving forward, you're gonna get to light at some point. And that is the ultimate goal of our collective work. We often underestimate our ability to make a difference and to create lasting change for children and families across this country. We sometimes allow ourselves to believe that our efforts are not enough to match the enormity of the challenges that we are trying to confront. But I'm here this morning, I stopped by this morning to remind you that your impact is far greater than that which you realize. I'm also here this morning to remind you that all things are possible when we recognize that we are not alone in this work. All of us together as a community, with our collective efforts, are making a difference in the lives of vulnerable children and their families. You see, I've come to understand that there's a power that is greater than any of us as individuals or as single organizations. There is a greater power when we connect our efforts and when we walk this walk together in community. There's power in communities of hope. Casey Family Programs was created in 1966 by the late Jim Casey, who's the founder of UPS. At that time, Mr. Casey was a 78-year-old retired businessman who believed that he could make a difference in the lives of the many thousands of children who were getting impacted by the newly created federal foster care system. Mr. Casey had no background in raising children. In fact, he had no children of his own. He had never worked in social services or social welfare, but he had looked into the eyes of the young men who worked for him all of those years in UPS. And he had seen something looking back at him that suggested to him that some of those young men didn't have the same background in family stability and in family support that he believed was responsible for him and his siblings. He believed that what his mother gave to him and his children, his siblings, made all the difference in who they were as adults. With the creation of the federal foster care system between 1960 and 1962, the federal government had taken a more expansive and a more intrusive role in the state responsibility for child protection, the state responsibility for child safety, and the state responsibility for family services. In this new role, the federal government required states to respond to families identified by the states as being in need by doing one of two things. They would either work with those families to address the issues that were causing the challenges that the states recognized, or they had an option to take the parents of those children to court and to request that the judge would give the state an order to remove those parents' children and place them in this newly created federal foster care program. The challenge was that the federal government made funding support available to states to cover some of the costs of the foster care program. The federal government did not, I repeat, did not make any funding available to help the state governments offset the cost of family support services. Consequently, in the 39 years from 1960 to 1999, the number of children in foster care in the United States reached a high of more than 560,000 children in foster care by 1999. And even as the number of children in foster care continued to rise in the late 1990s, there were leaders, like many of you in this room. There were advocates, and there were community leaders across America who were searching for ways to understand and for solutions to overcome these unacceptable conditions that were impacting far too many of our children in certain easily identifiable zip codes across the United States. And the United States did then, and as it still does today, lifted itself up as one of the greatest and richest nations in the world. But we had almost 600,000 children in out-of-home placement. Those leaders were trying to answer some very complex questions. What do we do to create a system focused not entirely on child protection and welfare, but to create a system that was focused on well-being of the child, well-being of the parents, and in fact, well-being of the entire family? They wrestled with the question of what do we need to do to create a system that required us to build solutions based on the strengths of families and not just on their deficits. Like, what's wrong with these parents? Like, what's missing in their behavior as parents? Or what are these parents not doing that is causing the conditions that the children are living in? Those leaders were also focused on the question of what did we need to do to create a system that doesn't attempt to address the needs of children in isolation, separate from the needs of their parents, or these combined needs of children and parents separate from the needs of their communities. But rather, we needed to build a response system that takes into account the needs of the children in the context of the needs of their family, and that takes into account those combined needs of children and families in the context of what was going on in their communities. And lastly, those leaders were looking to understand what did we need to do to create a response system that instead of limiting the scope of possible solutions to those that were identified by the government or identified by the courts or identified by the lawyers, how could we increase the scope of possible solutions to include those identified by the family? Novel thought, right? You ask somebody what they think they need, as opposed to prescribing to them what you have determined that they need. To identify those that were identified by extended family members, the people who probably had been working with those same parents and those same children for an extended period of time, saying, let me help you with this. This might work for you, but yet we were relying on the government, the courts, and the lawyers to decide what they needed. Or even accepting possible solutions from people who were alumni of foster care. You know, the best way to really understand what a system is doing and is not doing is to talk to the people who've been impacted by what that system is doing or not doing. Or how about asking members of the faith-based community what might be some possible solutions? Asking members of nonprofit organizations what might be possible, and asking other caring members of the community where these families live what might be the possible solutions to help those families with the challenges that they were facing. One of the things that always bothered me when I was commissioner in New York City was when a case hit the press that said something had gone wrong, I still got some of those skills, but you didn't know that, did you? There were people who would come out of the woodworks who would say, I knew something was going on. I tried to help them, but the government didn't do anything. If you knew all of that, okay, that's the wrong speech. I'm not going to go there. But you know where I'm going. During the span of my career in child and family well-being, from 1983 till today, total of 43 years. Don't I look good? I've worked as a caseworker, as a supervisor, and as a director in prevention services for community and government organizations in New York City. I've served as the commissioner of New York City's Child Welfare Administration. I am currently serving as the president and CEO of Casey Family Programs. Throughout this time, over the last 40 years, over the last 20 years, the nation has made continued efforts and tremendous gains towards becoming this system of well-being as opposed to this system focused on welfare. 20 years ago, in 2006, Casey Family Programs adopted its Building Communities of Hope operating framework. Hope is both Casey Family Programs' anchor and it is our North Star. That's why I'm so honored to be talking to you this morning in Hope Chapel. I couldn't have asked for a better location to talk about what I want to talk about. Because hope, being that anchor and being our North Star, it is what we do is grounded in and guided by the belief that every child in America deserves to grow up in a community of hope. But for us, hope is not a passive word. Hope is not putting your finger on something and just hoping and waiting that something is going to be different. One day God is going to come. Well, God sent us. That's right. And so for us, hope is an action word. Communities of hope are places where everyone has come to realize that the greatest gift that we can give to children is to embrace them, to nurture them, and to support them, and to instill in them a belief that no matter what the situation in front of them looks like or what it feels like, that they are not facing that situation alone. Communities of hope are places where insufficient income, what some people refer to as poverty, I call it what it is. If you don't have money, you can't buy your way into sufficiency. So insufficient income can no longer be allowed to either intentionally or unintentionally be treated as willful parental neglect of children. Communities of hope are places where the zip code where a child is born is no longer allowed to be one of the most determinant factors in predicting the likelihood of the success or failure of children in their lifetime. I've often gone into communities to meet with leaders for the first time. And before going into those cities, I've done some analysis of the conditions in certain zip codes in that city. And before beginning my conversation with them, I tell them where they are spending the most of their time in their police force. I tell them where they have the worst educational outcomes for children. I tell them where they have the most kids in their community going into foster care. And without fail, every time I've done that, they've said, "How did you know that?" And my answer has always been, "I just looked at your zip code data." Because communities of hope are places where the zip code where a child is born can no longer be one of the greatest predictors of the number of years that that child will live or whether they will even reach adulthood. Communities of hope are places where children are safe, where families are strong, and where communities are supportive, and where children, all of our children, are well. And it doesn't take much to look at certain zip codes and understand why the outcomes over here look very different than the outcomes over here. One small example in how we behave is that there are certain women, when they give birth to their children in a hospital, they are immediately tested. The children are tested. The mothers are tested for drug and alcohol. There are other hospitals in the same city where certain mothers give birth in the same way, but they don't get the same tests. And their children are treated differently, and those mothers are treated differently. In 2005, we at Casey Family Programs asked ourselves a very challenging question. What would happen if by the year 2020, if nothing changed in the way that America was treating its most vulnerable children in the year 2005? 15-year window. We calculated that in the 15 years from 2005 to the year 2020, if nothing changed, nearly 14 million more children would be confirmed as being abused or neglected by the year 2020. If nothing changed, 9 million more children would have entered the foster care system between 2005 and 2020. And 300,000 more young adults would have aged out of foster care only because they have reached the legal age of adulthood, regardless of whether or not they had the ability to be there, the resources to be there, or the support that they needed to live independently as adults. And the most painful result out of that data that we looked at in 2005 was that if nothing changed between 2005 and the year 2020, 22,500 more children would die in the United States of America from child abuse and neglect. And most of them would die before they reached their 5th birthday. That answer, and the possibility of that answer becoming the reality for any child in America, is what drives me to this day to do the work that we do at Casey Family Programs. It is why I stand here before you today to say thank you for what you do for children and families across this country. To say thank you for what you do for children and families across this country. And I also call on leaders across this country to be willing to invest as much or more in changing the future for other people's children as we're willing to invest in changing the future for our own children. After working in New York City nonprofit sector for 11 years, from 1983 to 1994, I accepted the role of Deputy Commissioner at the New York City's Child Welfare Agency. When I took that job in November of 1994, there were more than 43,000 children in New York City's foster care agency. We were conducting more than 54,000 child protective investigations every year, and we were removing approximately 13,000 children a year from their parents and their families. It hurts me to say that that's what we were doing, but the reality is that's what we were doing. That's what government was doing. That's what we were using taxpayer dollars to do. That's what we were spending more than $20 billion across this nation at that time per year to keep children in foster care. And in 1994, it wasn't just happening in New York City. It was happening in cities across this country. In my heart at that time, I knew that something had to change. Something had to be different, not just in New York City, but across this nation. And we immediately set out not to just hope and pray, but we set out to do the work. And between November 1994 and July 2004, when I joined Casey Family Programs, New York City had reduced its foster care population from over 43,000 children to approximately 22,000 children.
Praise God.
My experience in New York City led to Casey Family Programs, confronting the question in 2005 of what would happen if nothing changed for vulnerable children in America. The answer painted a picture of a future that was so unacceptable that it compelled us as a foundation to commit to working towards ensuring that that outlook never became a reality for any child in America. That moment in our collective history compelled us to answer with the only counter response that we can really have. Find a way to bring hope to those children and to bring hope to those families and to bring hope to those communities. The same hope that those mothers from the other zip codes take for granted every day. The same hope that the families in those other zip codes, believing that they somehow are doing this for themselves, take for granted. I knew that in that moment, we had to believe that faith was the substance of all of the things that we hoped for, and that that same faith had to be the evidence of all of the things that we could not see in that moment. In 2006, Casey Family Programs began laying the building blocks for our Building Communities of Hope framework. We began by recognizing that the biggest challenge facing America's children at that time was not the parenting of people living in certain identifiable zip codes. The biggest challenge facing America's children in 2006 was the hopelessness of the people living in those zip codes that we had allowed to exist, especially the hopelessness that existed as the daily existence among the most vulnerable children and their families. We even created a terminology called extreme poverty. It's shameful. I used to work in government. When you can create terms to describe an abominable situation and then do research and talk about it. Extreme poverty was defined as a family of 4 who were trying to live off of the equivalent of $8 a day per family member. How many of you drink Starbucks? How many of you know how much one cup of Starbucks costs? But hope was our way out. And because of hope, since the beginning of our Building Communities of Hope framework in 2006, the nation's foster care populations has declined by 38%, from 486,700 children in 2005 to 303,500 children in 2025 for children who are under the age of 18. When we include the number of young people in foster care under the age of 22, that was one of the changes that occurred. We no longer require in this country that at 18, young people have to leave foster care. That number is up to at least 22, the end of your 21st birthday, and for some places it's going up to 25. When you add those young people in, the decline has been 35%, from 510,700 young people in 2005 to 333,000 in 2025. Something is different for children across America today. Something is different because of what you do every single day. Something is different because of what CarePortal does every single day. But something is different in New York City because of what we did. In New York City, the 43,000 children in foster care in 1994 has been reduced to less than 7,000 children in foster care today. That's a reduction of more than 80%. And this shows that nothing is impossible when we believe together, when we work together, and when we decide that nothing will stop us. I am constantly reminded that at the Tower of Babel, that God looked down and saw that people were talking to each other, understanding each other, working in one accord. And he said, we got to do something, because nothing is impossible to them right now because they're working together. Now, when God says they're going to build a tower to heaven if we don't do something to stop them because of togetherness, how powerful does that mean our togetherness has to be? In 2018, the Federal Family First Prevention Services Act became law in this country, increasing the availability of federal funding for prevention and family support services for families and children in need. In 2025, the Supporting America's Children and Families Act became law in this country. This act includes a requirement that insufficient income or poverty can no longer be the sole reason for removing children from their families and placing them in foster care. So the next time that you encounter somebody who is saying they don't have money and they don't have food in their refrigerator and we're going to take their kids, you tell them you're breaking the law. Because this is now on the books. And what many of you might not know is the first foster care program at the federal level was put in place because governments in the 13 southern states had made a decision that they were not going to give Black and Latino women the welfare cash exchange that they were giving to other mothers, because they said they were unfit mothers. When we start to label a certain group of our people to be undeserving, we have decided to become less than human. When we see change like the changes that we're seeing today, when we see the results of the intentional and purposeful collective work of the past 2 decades, it is beyond what Casey Family Programs can do alone. It is beyond what government can do alone. It is beyond what any one of our organizations can do alone. But it is not beyond what all of us can do working together. This is about what all of us have been doing together to make sure that children and families across this nation can thrive. It's about CarePortal making resources and people available. I told a couple of people this morning, back in 2005 or 2004, Casey Family Programs was working on a program that would have put resources in a pot so that any foster parent, any child, or any agency around the country could call up and say, the kid needs a bike, the kid needs to go on a trip, the kid needs that. And I came in and said, we're not gonna do that. And people hated me. Some of them probably hate me to this day. But the reason that I said we're not gonna do that is because what we were doing is not what CarePortal is doing. CarePortal is not giving stuff alone. CarePortal is bringing caring hands and loving hearts and circling them around young people and saying, we can make a difference in your life. There's not enough stuff that we can give anybody to change their life. Even if we gave them money, money doesn't always change their lives. Some of the tribal nations that we're working with, they have casinos, and one of the measures that they use to decide when and how much money children get when they turn 18 is a numerical factor. And you have young people who haven't had nothing until 18, and then in 18 they get thousands of dollars to do whatever they want to do with, and they buy stuff. And that stuff doesn't change the pathway that they're on because we don't have enough people surrounding them. This story is a story about when 5 sectors of a community come together, when the government sector stops working by itself and doing things in the shadows, and they start working with the nonprofit sector to say, you are closer to those people than I am, what are we gonna do? When the government sector and the nonprofit sector starts working with the philanthropic sector, and we in philanthropy stop saying, we got all this money, let me see who I'm gonna give some to. But those 3 sectors, government, nonprofit, and philanthropy, also start working with the business sector to say, you've had enough time to make money off these people in these zip codes. It's time that you join with us to do something to change the outcomes that exist in those zip codes. And then we take those 4 sectors and we combine them with the most important sector of all. The sector of the people who live in those communities right around these people who have these challenges. And when all of us come together, we have the power of the entire community working together to help children and families improve their lives. KC Family Programs currently works in all 50 states, DC, Puerto Rico, and the U.S. Virgin Islands, and we work with more than 30 tribal nations to help them figure out how to improve the well-being of children and families in their communities. There's one tribe that we're working with in Arizona, where they have realized that the average life expectancy for the members of their tribe is 52 years. 52 years. They're less than 2 miles from Scottsdale. Life expectancy in Scottsdale is more than 80 years. 2 miles across the road is 52 years. It is abominable that we would live with that. In a nation that holds itself up as the greatest nation to ever exist, there can only be one standard for our children's care, and that is the standard of our own. If the conditions that we allow to impact the lives of other people's children are not good enough for our own children, then those conditions can never be considered good enough or acceptable for any child in the United States of America. The well-being of each one of us impacts the well-being of all of us. It is not just our children for whom we need to secure well-being. It is everybody's children. It is other people's children as well as ours. And I want to leave you with something. When the story of how our nation treated other people's children is told in the future, what will those who are looking back at 2026 say about what we as a country thought about other people's children? When that story is told, and it will be told, when the story of our nation's legacy is told, what will they say? Will they say that the children were hungry and we fed them? Will they say that the children were thirsty and that we gave them something to drink? Will they say that the children were naked and we gave them clothes to wear? Will they say that the children were hopeless and we as a nation, as a society, we made a conscious decision, a deliberate decision that we would become their reason to hope? Or will they be left to conclude something else? Let that sit with you for a minute. Will they be left to conclude something else? I'm reminded this morning of a song that I'm not going to sing, thank you, by Luther Vandross. And those of you who don't know who Luther Vandross is, you was wondering, I didn't think that was necessary, but I thought I'd say it anyway. Luther was nominated for 31 Grammys. And there are many of us who believe that he should have won at least 20 of them. He only won 8. And he won 4 of those 8 in 2004. And 2004, Luther suffered a massive stroke. And he died about almost 18 months after winning those Grammys. This one that stood out to me was his song, Dance With My Father Again. The lyrics of that song, back when I was a child, before life removed all the innocence, my father would lift me up and dance with me and my mother. And then he would spin me around till I fell asleep. Then up the stairs he would carry me, and I knew for sure that I was loved. If I could get another chance, another walk, another dance with him. I'd play a song that would never, ever end. How I would love to dance with my father again. Like so many children in foster care in this country, I never had the chance to dance with my father. I never had the chance for him to spin me around, to carry me to my bed, and to make sure that I knew that he loved me. Every day, those of us in this room and those of us in this country have a chance to make sure that there are children across this country who, without a doubt, know that they are truly loved. CarePortal and all of you in this room are doing an amazing job for other people's children. It is noble work, it is righteous work, and I encourage you to continue doing the work that you do every day for other people's children, to continue being a part of their community of hope. Together, we've made tremendous strides for children and families across America, but we still have many more victories that need to be won. Thank you, and may God bless and keep you all.
Dr. Bell, just take a look for a moment.
You all appreciate it, brother. Thanks for bringing your heart. Thank you. Good. Your manners.